Hi, everyone. My name is Dr. Christina Carreau. I'm a naturopathic doctor, and I'm sitting here today with Jody Snider, another naturopathic doctor, also a really good friend and colleague of mine. And I invited Jody here today because she's got a special interest in mental health. And her and I were chatting just before we started this video, just about, mental health in general. And the pandemic has been hard on all of us, and mental health. Again, I think that we need to have more conversations about this, just as we understand, physical health is on a continuum. Mental health is on a continuum. There's always work to be done and always improvements to be had. And the more that we can cultivate relationships with our physical health, our mental health, our spiritual health, our emotional health, the more that it puts us in the driver's seat in terms of being able to navigate everyday lives, let alone challenging times. So anyway, Jody, thank you so much for being here with us. And I'm really excited to have this conversation with you.
Yay, thanks for having me. I love what you're doing. I love how you're trying to get the message out to empower your patients and your community to just really focus on their own health and what they need. As you say, I think it's a conversation, particularly with mental health, but with health in general, that needs to be had, how we can influence the power that we can have on our own well-being. So yeah, happy to be here. Happy to join the conversation. I love it.
Amazing. Thank you. So I will just dive right in and allow you to be the expert for us on all things mental health. So I'll start out with, Jody, what does mental health mean to you? Like, how are you usually having these conversations with clients?
Right. So mental health to me, so just to go back, I guess, to what I had said, there is really no mental health if there's no physical health, if we don't have a state of somewhat spiritual health, physical health, mental health, right? They're all combined. Our body feeds our mind feeds our body. So really, we're just talking about health in general. But yeah, mental health specifically, as the focus of today's conversation, I think it's just a state of mental emotional balance. And balance is an overused term, so I'm going to even define it further than that and say by balance, what I mean is not an absence of highs and lows, because it's just not realistic. We all have bad days. We all have good days. There's always external forces or stressors that are going to be affecting our mood, whether feeling stressed out, overwhelmed, especially anxious, sad, whatever it is. To me, the balance comes in when we're able to, and hopefully, I love what you're doing. You're giving your patients, your community tools. Hopefully after this conversation today, people feel like they, again, have a few more tools to do this. But balance means coming back to a state of ease or peace or balance, if you want to say, again and again and again. So I'm human, right? I'm not always going to feel just balanced all of the time. I'm going to have highs, I'm going to have lows, but we need to be able to bring ourselves back to that state where we feel more at ease over and over and over again. That's life, right? So to that end, if you're someone who has been dealing with depression and anxiety, let's say for years, maybe taking medication, maybe not, then we're going to talk about some foundations to mental health. And that's more of a treatment for these individuals. For many of us who are just feeling overwhelmed from time to time, stressed out, maybe like there are some days where we're drowning a little bit, then some of these tools are going to be more of a preventative form of medicine, right? We're using these tools to prevent the need for medication or to prevent a diagnosis at some point. Because if we just keep pushing that feeling down, I'm overwhelmed, I'm just gonna survive. Every day I'm just gonna survive. It is going to cause long-term issues at some point. So to that end, again, these are foundations, but we can really view them as treatments and certainly as preventative medicine to that extent as well.
Yes. Amazing. Yeah. And even as you were, sort of describing that, what was popping up for me is sort of, like step number one, awareness.
Yes.
We're just all so busy. And so even just being able to have a, sort of this, just being able to have the awareness that we need to check in on some of these different pieces, right? A lot of us are walking around maybe feeling a little bit anxious or maybe feeling a little bit down or maybe feeling overwhelmed or irritable, but maybe we haven't even taken note of it. Maybe we're not even aware that that's actually part of the way that we're interacting with the world or interacting with ourselves. And again, because we are so busy and because life is full of so many distractions, that just having this measure in place where we check in with ourselves, where we're able to sort of self-identify. And again, just sort of also highlighting what you just talked about with regards to, when we're having this conversation, we're talking about tools. And I want to be really clear that we're talking about tools for people in that gray area. These are not necessarily tools if you have a full-on, mental health diagnosis. We're not trying to say, okay, buck up and think happier thoughts and eat better foods or anything. So this really is about empowering people that are, in that position or in that spectrum that don't have official diagnoses, right? But that all of us have this sort of anyway. So just wanting to highlight that. But yes, so awareness and everything else that you're saying, seems so critical for all of us. And again, if we just want to break this down even further, like why is it important for us to be having this conversation? Why is mental health important?
I feel like over the last couple years, especially, and I just feel like we've lost a lot of our power. I feel like somehow it's been sort of lost that we can impact. There are actually actionable things that we can do on a daily basis, actions we can take that will impact our health. And I feel like the further we get away from that, the further we sort of leave that locus of control as external. I just feel like we're never going to really get there, right? We have to be doing these things on a daily basis in order to sort of feel our best, to feel optimal. And so I think that the conversation is especially important right now because there is such a rise of depression, anxiety, such a rise just in the state, in a feeling of stress and overwhelm. And then the disconnect, as you say, gets added into that. We're disconnected from each other. And I think somehow in all of this, we become disconnected with ourselves in the sense that we're not asking ourselves the important questions. And maybe it's because I can only speak for myself and other women that I know were in the same position, but we've been working, we've been teachers, we've had all of these different hats to wear, and there's really been just a disconnect in terms of checking in. How am I feeling? And not how am I feeling in my body, although that's a really important question too, but how am I feeling? Am I feeling in control of my emotions right now? Am I feeling overwhelmed? Am I feeling stressed? And then why am I feeling this way? And what can I do about it? We're not asking these questions because we're too busy to be asking these questions. And then again, the last couple of years disconnected from our peers and even to a certain extent mental health supports. Again, a lot of people doing things virtually, and that's great. And I actually love how quickly things have spun and how easy that has been to do, but that's not for everyone either, right? Some people need that face-to-face connection. And so we've lost that connection. So I feel like that's what makes the conversation so vitally important right now is, again, not as an alternative to any other form of treatment or therapy, but in addition, how are we building the foundation so all of these other things we're doing work better? We're not having that conversation. That conversation needs to be had.
Yes, I could not agree more. And I really do love what you said about the loss of power, because I think that is huge, right? In terms of the work that needs to be done is very much about individuals being empowered in this journey of health or healing that's ours. And we don't always want to take that on because it feels like one more thing on the list of to-dos. And when we're already feeling overwhelmed and inundated with all of the checklists and everything, it's like, oh, great, now I have to take care of myself too. Where we were very comfortable kind of scratching ourselves off the list and knowing that we'll get to it. But just realizing that it gets harder and harder to get to it because the further back we are, the more overwhelmed that can sort of creep in. And so again, just knowing that it's an opportunity for us to not go from 0 to 100, but to go from 0 to 4. To just or to go from 4 to 8. Like I'm not pretending that that all of us are giving zero attention to this, but just really realizing that it's not about creating overwhelm on top of overwhelm. It's about small actionable items repeated over time that will land us where we want to land. So again, yeah, recognizing that, baby stepping our way back to a place where we feel in a position of power, or where we feel in control, or like you said, where we know what questions to even ask ourselves. So I would love if you could just highlight those questions one more time for us, Jody, in terms of like, what questions do we need to be asking ourselves in order to check in with ourselves in terms of mental health and wellness? Could you just repeat those?
Yeah, so my big three are, how am I feeling? Why am I feeling this way? And what can I do now to make myself feel better? And again, it might be, like you say, it might just be take the edge off. It's not that, you're going to go for a walk outside and your whole world is going to change. But is there anything you can do in that day to just take the edge off, so everything just seems slightly more manageable? And it's those baby steps that, like I say, are the foundation, so incredibly important, or else we're just surviving all day long, doggy paddle style.
Yeah. Amazing. Those are great questions. And I even have one more question that I sometimes layer on top of that is what can I do in this moment to make me feel good? And will that continue to make me feel good moving forward? Right. Because sometimes like 3 glasses of wine can feel pretty good. Or like a whole bag of potato chips, actually, hey, yeah, that's making me feel good in the moment. But are these sustainable practices? And not to like poo-poo on any, sort of practices that are self-soothing in the moment, but ultimately, if we are talking about mental health and wellness long-term, we want to be reaching for things that are not only giving us, this self-soothing in the moment, but that are going to support health and wellness sort of longer term. So it's almost like a question on, sort of like a next tier almost, right? So it's good when we find the things that support us now, but just being sure that we're not sending ourselves further from the start line kind of thing.
Yeah, absolutely.
Awesome. And then in terms of actionable items or steps or health habits that you will often talk to clients about, just in terms of, taking charge of their mental health or moving the needle, can you give us some of the sort of foundations of mental health that you like to speak to?
Yeah, so especially in the last month or so, I've been talking a lot with my patients about just getting outside, taking in some natural light at some point during the day. And again, I think this has been exacerbated over the last couple of years with us being inside on screens quite a bit. Many of us work in a space, whether it's at home or in an office in which we don't have windows. So there's really no natural light coming in. And then we're wondering why we're having trouble sleeping, because our body literally has no cues as to what that sort of natural internal clock should be set at. So I think it's so important that we get outside in natural light, particularly early morning light and late daylight. And so, as I say, I know that that's much harder to do over the winter, which is why I've been really kind of getting back on that with my patients just over the last month or so. We really want to cultivate more and better quality sleep by, as I say, just sort of giving our body cues for where that internal clock should be. And I feel like sleep is just so huge and really needs to be the starting point for a lot of us, because we're able to make better decisions, one, when we're more well rested. Which then maybe we're making better dietary decisions because we've had a better sleep. Maybe in general, obviously our mood is going to be slightly better if we're feeling better rested. Anxiety ideally should be lower if we're feeling better rested. And I mean, Christina, I'm sure you're finding the same thing in your practice. I don't know if I have a patient who walks in. I shouldn't say that. It's certainly in the minority if a patient walks in and says, yeah, I'm a great sleeper, no problems, I wake feeling rested every day. Like that, I'm not hearing that from people. So I think in general, people are, our community is sleep deprived and not waking rested, and we need to do something about it. So early morning sun, late day sun. Ideally, in a perfect world, we're getting up, and within the first half hour to an hour that we're up, we want to be outside for, the research is kind of supporting about 20 to 30 minutes. I'm not sure how realistic that is for everyone, but I say 5 minutes is better than nothing. And some people will take the opportunity to move their body at this time. Also great. We know exercise has tons of benefits, and that's something we can talk about at a different time. And I have some patients that just sit outside and have their coffee, and that's also great. Ideally, we want to actually be facing the sun, not asking my patients to be staring directly at the sun for 20 minutes by any means, but facing the sun. And in a perfect world, we don't want sunglasses on. We actually want the sun and we actually want the sun to hit certain receptors in our eyes that based on where the sun is and how high it is, that's being reported back to the brain. And again, that internal clock is being set. Same with late evening, so kind of dusk sun. Again, that sunlight and where it is in the sky is actually hitting some receptors in the eyes, which are then feeding a message back to the brain. The other thing in sort of addition to that idea of resetting the internal clock and helping with sleep is especially early morning sun. It's really important for a lot of the neurochemicals that are so important to our mood in general. So dopamine, serotonin, certainly cortisol, epinephrine are generally high in the morning, but when we're giving a trigger to our body that it is morning and it's time to be awake, those levels are going to be better. That's going to help with energy, motivation. It's going to help our mood in general. So it's kind of twofold in the sense that yes, it's helping with sleep, which then improves our mood, but it's also, again, really helping with that neurochemical release that helps us to feel more motivated, more energized in the morning. And then similarly in the evening, you know, with the light going down, we want to come inside. We want to try to keep overhead lights dim or off entirely, maybe use lamps, even candlelight if you like it, because we're trying to sort of, again, stimulate that melatonin production, which happens in the evening, again, as part of that circadian rhythm or sleep-wake cycle. We want the body to release melatonin in order for us to have a good quality sleep in the night as well, through the night as well. So I think it sounds like a really simple thing, just getting outside and enjoying some sunlight. But I notice when I don't have it and don't do it, and it is extremely powerful, and definitely by all means that idea is really supported by the literature as well. It's a really, really simple and powerful tool that we can use.
Amazing. Yeah. So yeah, I think that those are great, great tools. Of course, we could go on and on, right? Like this list is so long in terms of foods that are good for mental health and mindsets that are good for mental health and exercise and connection and all of these different pieces. And so again, we will dive deeper into this topic at some point, but I think that that's a really good one. And we know that nature heals, and whether, like you said, a few times, whether or not it's, getting up and getting out of the house first thing in the morning, you will benefit from getting outside regardless of what time of day it is. And so getting out, being with nature, feeling connected to something that has been around much longer than we've been around and will continue to be around much longer than we're here. There is something very healing and very soothing with that. And I would, one other thing that I would layer into this conversation as well before we wrap up would be again to just make this sort of a practice of like falling more in love with taking care of ourselves. I know it sounds so cliche, but again, when we talked about that long list and we talked about, how many things we have coming at us and how many different hats that we've worn, when we start talking about, adding anything in, like when sometimes we can have resistance to doing anything extra. And so we want to cultivate a relationship with taking care of ourselves that isn't a chore. It's not work, it's a gift. And so really it's just looking at it, glass half empty, glass half full, cultivating a relationship where we really think that this is a privilege to be able to take care of ourselves and look after ourselves. And sometimes we think that, what's going to help our mental health is the latest nutraceutical that's been researched. And I'm not going to pretend that nutraceuticals can't help us, but sometimes I feel like we overlook a lot of these foundational pieces and we're reaching for something that's, off of the shelf without doing some of these, A, B's and C's, we'll say, of just sort of looking after us. And so
sure. And I do think, in fairness, to start, some of these foundational things do 100% seem like work, right? Because maybe in order to do this, you are getting up 10 minutes earlier, and that's hard, especially if you're not sleeping well. But I think you put the work in for a little bit, you make it a priority for a little bit, and you do fall in love with the habit, and it becomes a habit, and it becomes something rote that you even to a certain extent may crave. And so if initially it seems like work, it won't always seem like work, right? And maybe we're worth the work. I also, it doesn't, just because it's not easy, it doesn't mean that it's not worth it, right?
Yeah.
Yeah.
Exactly. I mean, we have so many different examples of this: parenting, marriage, naturopathic college.
Yes.
Anyway,
Yes.
like these are all, it depends which lens we're wearing, but yes, they're all gifts, but they are all work. And yeah, anyway, thanks so much for having this conversation with me. Thanks so much for sharing all of these pearls of wisdom with us. And I really do look forward to future conversations. And I really do hope that this does provide some tips and tricks for people that may be struggling with mental health, as I know so many of us are. And
Yes,
as we're here to basically say, it is okay if you're aware of the fact, that your mental health needs work, then you've already taken the first step. And now there's permission to open the door on all of these different avenues that you can explore. So anyway.
Yes, absolutely.
Yeah.
Thank you so much for having me.
Yes, thank you so much, Jody. Take care.
Okay, bye.
Bye.